Apparently there was little or no oversight for this, and it sounds like it just simply ran amok.
Yeah, there were a number of problems that went into it. One, they started out offering $61 an hour for this service.
To private contractors.
To private contractors who were paid by Medicaid instead of through local vendors who could monitor their activity. They were approved once, and then they were pretty much done with oversight at that point. And the work doesn't involve highly skilled people who you have to pay $61 an hour. Some of this is taking people to the movies. Some of this, and so there was abuse of it too. That
really, they were taking people to the movies.
Some of it was, yeah,
money?
that was taking people to the movies or watching children as they do their homework. So the idea of community support is good. What was happening was questionable, and then because there was that $61 an hour for relatively low skilled work. And then once somebody's brought into your house, well, you might as well keep them there, right? Because you're not paying, and they might as well stay there because they're getting paid $61 an hour. The company's getting paid $61 an hour, and it's probably not a bad job, $10 an hour or $20 an hour to kind of sit there and help somebody with homework or go see a movie. You can't argue with that on the provider side, and on the state side, it got blended in with everything else, and nobody was paying attention to the line item to say what's going on with community support until.
Or why are we reimbursing for movie tickets, perhaps, would have been a good question to ask at some point.
And so you end up with a huge expense that blew up. The report calls it the surge of costs, and that's probably a good explanation of what happened. It just the cost blew up within about 6 months, and once the administration found out, once the Easley administration found out that this was happening, they turned around and cut reimbursement rates down to 40, which then left those good providers with less money to be able to work with.